this now. The Health Department has published new regulations under the National Health Act, and these are said to act as a new instrument for the government to manage the current COVID-19 pandemic and future pandemics. So to tell us more, I'm now joined by health expert Dr. Kgosi Letlape. Doc, always a pleasure talking to you. Thank you so much for your time. I mean, the government has been receiving pressure to end the national state of disaster. The eNCC, on the other hand, has constantly insisted they can't just make that decision without ensuring that they do have the necessary regulations in place to continue protecting, people's lives, but also to protect, of course, for any other future pandemics. Are we seeing that in these new regulations? Are we seeing, of course, the Health Department taking a turn which says we are introducing these regulations, or at least publishing them, so that we may ready ourselves to end the national state of disaster?
Good morning to you and the viewers. Yes, we are seeing that with the regulations. If you read through the regulations, all the actions that have been taken from the beginning last year, 2 years ago in March, have been incorporated into the regulations. What that means is that once the regulations are enacted and are in operation, there's no need to create a state of disaster to act. The department can just act on any pandemic or any highly infectious disease that comes into our midst.
Doc, how would you then compare South Africa to other countries? How do you think we fare? Because looking at the likes of China and the UK, where Boris Johnson took a decision to scrap all lockdown regulations, even in the midst of the Omicron variant, how do you then compare South Africa in terms of lockdown trends and regulations, and how other nations have fared, even while we're still in a pandemic?
I think we've done well. Remember that you can't emulate what happens in the UK because you are not the UK. Right. You do not have the health system that the UK has. You do not have the resources that the UK has. You do not have a social etiquette and behavior of society that the UK has. You don't find people litigating in the US when their government takes action. As you see in South Africa, you've seen what the DA has said, that is going to take the government to court. So you got to act within your reality. And within our reality, you need an enabling framework that is part of the law, so that when you have to take action to help society, you are not in court frivolously. So we got to adapt to our own situation and learn from the world, but adapt to our own reality. And we make rules that are applicable to our society. Yeah. We learn from other societies, but we do what is appropriate for us. That's why we have our own council that advises the minister on these issues. And all those people that sit there with all the sectors represented will make representations to the ministry. And eventually it's up to the government to make the decisions that need to be made.
So context is the point you're making, bringing into the South African context while making those decisions. But let's speak about those who are part of the stakeholders advising the eNCC and government on these regulations. Doc, I mean, I know that the regulations seem to be leaving a door open here for advice giving between different departments. What does this mean? And also, how will it address some of the criticism that the eNCC has received, that some, if not most of their decisions have not been scientifically backed or based?
I think there'll always be argument around those issues. But when you look at what people say locally and you look at what the WHO has said about South Africa's response, it becomes quite different. We've been praised in terms of how we've responded. So you must always understand that in the context of South Africa, given our background, there'll always be politicking. And when you have the biggest problem that we have is that the response has been politicized. And you then you find political adversaries trying to take advantage of each other. And that's what's unfortunate about the South African situation. When you look at the responses elsewhere, you do not have the different political parties in their parliament speaking differently on this matter, because the matter is not politicized, it becomes a health matter. And our problem is that there's too much politicking in this country. And I hope as we move forward, the response will be the response of the health system rather than the response of politicians. and we will have politicians go out. There are things that we should learn. It should be a national response. We should get out of this fantasy league of each province having its own press conference, occupying the airwaves, repeating what has been said centrally, so that we have one nation, one response. And this should be led at a national level. And some of the concerning things when you read the regulations, especially on issues like isolation, it's where it now becomes multi-department situations that might create paralysis. We need all the decisions to be taken by one unit. The final decision-making should sit with one ministry. This multi-ministry things is going to paralyze us. You've got to have isolation issues, and you've got to go to public works. You've got to go to provincial governments. You've got to go to local municipalities. Those things should be in the background. This should be a national response and a national structure, which in this instance, because it's a health issue, is the National Department of Health should have authority to decide where to place the isolation units. This thing of consulting, or the budget is in the province, or the municipality doesn't agree, and we should be prepared where we have pre-identified areas for isolation that are ready and prepared, where the facilities would be equal to any private home of a billionaire or a millionaire, where it is adequate in terms of the facilities for the patients, etc., etc. Those are the things that we should be talking about.
I definitely hear you, Doc, on the response rate from government, it being sort of almost singled out just to one department, making for quicker implementation and action. But where does that leave the agency and responsibility of the ordinary South African? Yes, we definitely know of the responsibility that needs to be expected from government or even the health department. But where do you think then lies the agency from the ordinary man on the street in ensuring that they are protected, but also they protect the next person?
The agency lies in how we educate and how we mobilize. Unlike the current response, which has been corporate-based, we need to take it out to the communities. We need to involve the NGOs that are involved in health. We need to involve traditional healers. We need to involve general practitioners. We need to involve independent frontline healthcare professionals as vaccine sites, so that we are where the people go for their daily health care, and we take the response to the people rather than creating mountains and expect the people to come to the mountains. Remember, access is an issue for some of our communities. And with the rising costs of petrol, there'll be rising costs of transport. And that might limit access for vulnerable communities. So we need to ensure that our response is embedded in the community, and we need to use all the structures to be able to educate so that there should be no need for vaccine mandates. People should know that that is the right thing to do. And the right of an individual to refuse treatment should still be sacrosanct. There are things that are concerning in these regulations about forcing prophylactic treatments that might be experimental, that might be under emergency authorization and are not reproduced. So there are issues that we need to get into and discuss, and the rights of people. I was listening to a previous conversation with the labor people, where we're becoming a military state, a police state in the environment. Nobody talks about the responsibility of the employer to create an enabling environment for a person that chooses not to be vaccinated, just to ensure that everybody is protected, even that person that makes a different choice. The employer, just like we create an enabling environment for people that are differently abled, the employer should be compelled to ensure that everybody is protected. If even the one that chooses not to vaccinate but is not ill, is not infected, should be able to come to work, should not be fired, and should be protected. And the employer should be compelled to create an enabling environment to ensure that all the employees are protected.
Thank you so much, Dr. Kgosi. We have to leave it there due to time, but definitely point taken. And I appreciate you speaking to me about this morning. Health expert, Dr. Kgosi Letlape, thank you so much for your time this morning.